Here's something to get excited about. The Asian Festival is coming up. Every year it brings more than 100,000 visitors to Central Ohio. Isn't that amazing? Today's guest is Dr. Greg Lamb from Ohio Health, the Ohio Asian American Health Coalition, and the Asian Festival Corporation. We talk about all the events happening to celebrate AAPI Heritage Month, including dragon boat races, table tennis tournaments, and free health screenings. Dr. Lamb also talks about the health disparities in the Asian community and shares some stats and stories that you won't want to miss. All that and more coming up on Health is Real.
Come on in, stay a while. Andrew Stinson here alongside Zach Watson and Angela Ta. The name of the podcast is Health is Real from Franklin County Public Health, coming to you today as we normally do from our friendly confines here at Memorial Hall in downtown Columbus. Zach, how's it going today?
Just great, thank you.
Wonderful, wonderful. Angela, how are you doing today?
Stellar today.
And you know what? We're really excited for our guest today. Dr. Greg Lamb is here. He is a cardiologist with Ohio Health, Vice President of the Ohio Asian American Health Coalition, and Vice President of the Asian Festival Corporation. Dr. Gregory Lamb, thank you so much for coming on the podcast today.
Oh, thank you so much for having me. I am so excited to talk with you guys today.
Wonderful, wonderful. Well, let's get to know you just a little bit more. How would you describe your professional role and kind of what got you into the field in the first place?
Sure, yeah. So I am a cardiologist with Ohio Health. I've been here for 16 years in Ohio, originally hailing from Honolulu, Hawaii. And so people always ask, how can you come from Hawaii to a cold place like this? But we actually love Columbus. We reside in Dublin, and so very proud to be an Ohioan and also to live in Dublin as well too. But so I practice cardiology actually in Circleville, Ohio.
Oh, really?
Oh. Yeah, so a rural community, very different from Dublin. But it actually is amazing because I just love small communities. There's so much need there. People are so appreciative. And it just is very fulfilling to actually do work that actually helps people's lives.
Do you ever get to go to the pumpkin show?
I knew that was coming.
You said Circleville, and that's immediately what I thought of.
Yes. And you called it pumpkin show, which is good. If you call it pumpkin festival or pumpkin fest, people down there actually get very angry.
Yeah, they're like,
gotta get it right.
Yes. Pumpkin show is awesome.
Yeah.
It's huge. 500,000 people over the course of the week. Wow. The kids get off from school. There's two parades per day.
Wow.
Some of the largest pumpkins I've ever seen.
Massive.
Yeah. Yes. And so it's a lot of fun. If you have not been to the pumpkin show, you definitely have to go.
Yeah.
Yeah.
Well, it's fun too because you get the Dublin Irish Festival in Dublin. So you where you work and where you live, you get a lot of fun parties.
Well, and that's actually the beauty of being here in Columbus. It's a very multicultural place, a very welcoming place. There's so much diversity here, and hopefully one of the things we'll be able to talk about later on today is the Asian Festival itself too. But there's so much different cultural events going on, and we feel very blessed to be.
I know it's my turn to ask a question. I was actually trying to figure out, so this doesn't have to be on the pod, but story time.
We'll cut this.
No, story time. So my grandma lived in Circleville. So like for the first 13 years of my life, it was traveling from like near Urbana, sort of that part of Ohio, to Circleville. And I'm fairly certain, I was trying to figure this out, but it was during my youth when the pumpkin water tower was installed. Like it didn't always used to be a pumpkin water tower. I think they just had like a plain water tower that says Circleville. And then I just remember like, I don't know, like in between holidays once or whatever, it's like, is that a giant pumpkin? like I'm a kid, I'm like, huh?
So, I mean, it fits, right?
Oh yeah, it does. Yeah. So like, I mean, the pumpkin festival has just been such a pumpkin show.
Pumpkin show.
There's several Circleville people waiting outside for me.
You just lost all of your Circleville cred.
I know. Listen, hey, if anyone out there from Circleville, what did they call her? I think my grandma's name was Betty, and she worked at Bob Evans for 16 to 18 years and only missed a day one time. Only missed one shift. Wow. And they had to forcibly make her go to the doctor because she's like, I can work it. And she would tell me stories. She's like, I met the Bob Evans and stuff like that. I was like, what? She's like, he used to come here on game days. I was like, Okay, Grandma, wow.
You're like, all right, Betty.
Yes. Anyway, sorry to veer us way back on path. And again, that can just be cut. That was just a fun story. So to veer us way back on track. So I wanted to ask, what's something people, may not know about the AAPI community in relation to health outcomes, from what you've seen and what you know?
Yeah, that's a really great question. I think people are always surprised to hear that there's lots of health disparities suffered by Asian American populations in the United States. There's this model minority myth. It's sort of a stereotype that depicts Asian Americans as this successful, high-achieving minority. But it really belies the fact that the Asian American community is very diverse. It's very multicultural. There's a huge range of socioeconomic statuses with all the different ethnic subtypes. In fact, actually, the AAPI community has actually the largest economic disparities. And people don't realize that. But because of this model minority myth that, all Asians are doing great, it really hides the fact that there's a lot of health and social considerations or health outcomes that actually happen within the Asian communities. And it's tough because it's unrecognized and is therefore perpetuated. And so that's something that I think a lot of people don't really understand. So what are some of these disparities? I'm a cardiologist, and so I deal in the cardiology realm every single day. And every day we actually see that there are health disparities in cardiology, diabetes, smoking cessation within the AAPI community. The COVID pandemic actually really highlighted a lot of this for us. Turns out that on a federal level, but also on a state level, AAPIs were overlooked during a lot of the discussions, a lot of the plannings because of that. And because of that, AAPIs, they had a 49% more likely rate to die from COVID, a 57% higher rate of hospitalizations, and a 24% excess death rate compared to white populations. Here in Ohio, they were some of the last to be vaccinated. And so these are just some of the things that this model minority myth, but also just a lack of being at the table, or maybe even being at the table, but not having a lot of these health disparities recognized, it affects a lot of the AAPI populations. So Zach, so I think that would be one of the biggest things. We spend a lot of our time talking with people about health disparities within the AAPI population, and a lot of people are really surprised about that.
I'm really shocked by some of those stats, especially around the COVID pandemic. I guess, I feel like you heard a lot about, or I felt like I heard a lot about, comparing African Americans and the white counterparts and things like that. But you're right. I mean, I don't remember hearing a ton about like the AAPI stats, and that's wild. That is really, it just shows how far we have to go.
Yeah, and the consequences of this is far-reaching.
Yeah. Right.
So not only are there the health consequences, but then we actually take a look at the mental health consequences as well. And so just from COVID alone, you heard a lot about the anti-Asian hate that went around.
Yep.
Yeah.
And so 72% of AAPIs reported discrimination as being one of their biggest sources of stress. 95% during the COVID pandemic viewed the U.S. as being more dangerous for AAPIs. And as a result, you were talking about how this compared to non-Asian or white populations. So there was greater depression or anxiety, 49 to 41% from Asians versus non-Asians, greater stress related to mental health concerns, 69% to 52%. 68% of AAPIs said that they actually experienced some form of active discrimination during the pandemic. Yeah. And which is actually really, really surprising in some regards, but not so surprising if you're here and living it. And so I don't know if I should tell this story, but my son and I were riding our bicycles in Bridge Park in Dublin. And we're at the corner waiting for the light, and this big pickup truck was zooming by, and they said, "Go the F back to China, you." And my son was just flabbergasted. He was scared. He was confused. He didn't understand. He was born here. So he's an American citizen. And kind of an interesting fact, my wife is Caucasian, and her father is a PhD mathematician. And when he retired, he actually utilized all of his PhD mathematics scientific rigor skills to actually trace his family's genealogy. And so between my wife's mother's side and father's side, their family made up 11% of the Mayflower. 11% of the Mayflower population.
What?
And when you actually take a look back at some of these really big historical figures in American society, in American history, it's my wife's family. So when you think about my kids actually have all of the same connections, same privilege, if you want to call that, as some of these other populations. But here they are, and being told to go back to China simply by the way that they look. And so this is some of the issues that the AAPI community deals with, not only the health issues, but also the mental health issues as well.
Yeah.
Yeah, and just to add, it's like two things. Like I like first to sort of what you were saying, like it was so strange to encounter during the pandemic because I thought like I think it was both sort of said and unsaid that as like even by news organizations was like, and Asian Americans who are used to wearing masks and stuff like that. I'm just like, well, wait, like hold on, we can't like make these kind of like these kind of assumptions. And then my wife is Vietnamese Chinese, sort of mixed background, and I've never heard stories similar to what she's telling me of. She's a nurse at Mount Carmel. And she's told me, she's had patients that they're like, oh, where are you from? And she says, Cleveland, Ohio. No, where are you from? And then she just goes, Cleveland, Ohio, because that's where she was from, born and raised.
And Cleveland's a great place, by the way.
Yeah.
Coming from a Browns fan here.
A paradise.
Well, but Zach, and that brings up another of these common stereotypes, which is the perpetual foreigner myth. Mm-hmm. And so, my family immigrated to the United States. I've been American citizen for over 50 years. I don't speak any other language. But when I first came here to Ohio, my staff got asked all the time, does Dr. Lamb speak English? Will I be able to understand him? And so, and it's not anything bad. I mean, that's just people's lived experiences, and I totally get that, I totally accept that. But it is this perpetual foreigner myth where maybe they don't really belong. They might not speak English. They might... it's just all of these kinds of things, but these are all of these different issues, whether it's the perpetual foreigner myth, the modern minority myth, that actually works against a lot of the AAPI populations, that disadvantages them not only from a health perspective, but a social perspective, cultural perspective, and a acculturation perspective as well.
Yeah, and May is AAPI month. What are some ways people can celebrate that?
Well, I'm glad you asked. Because one of the things is the Asian Festival here in Columbus. People don't know this, but here in Columbus, we host the largest celebration of Asian culture every year. It's one of the largest celebrations in North America.
Wow.
That's incredible.
It's incredible.
We just Owen Wilson at the same time. Wow. That's amazing.
So the Asian Festival itself is always on Memorial Day weekend. And it's been around for 31 years. This is our 31st anniversary. It was first established in 1995 by Dr. Liu and Dr. Cora Munoz. And it's held each year at Franklin Park. Every year, we get anywhere between 150,000 to 200,000 people that attend.
Oh, my God.
I know.
So many people.
It's crazy.
Wild.
It's absolutely crazy. We have people from Canada, from China. They come from all over the United States that come. And it's one of the largest celebrations of Asian cultures this year. The festival itself is on May 24th and May 25th at Franklin Park. But the Asian Festival Corporation also puts on two other events to celebrate AAPI Heritage Month throughout the month of May. And so the first event is on May 10th. It's our table tennis tournament at the Table Tennis Club on 8th Avenue.
Fun.
It's a lot of fun. And actually the physical abilities of these amateur ping pong players is remarkable.
Unbelievable.
Absolutely remarkable.
Yeah.
And then, so that's on May 10th. And then on May 18th, we have our dragon boat races at Scioto River. Have you guys ever been to the dragon boat races?
I personally haven't.
I
Have
haven't.
you guys?
Have you guys ever seen dragon boats, how they look?
I don't think I
I don't
know.
know if I have.
No.
And so for anyone listening, do a Google search for dragon boats. They're these beautiful, beautiful large boats, big heads of dragons on the front.
Oh, man.
And it's teams actually representing a variety of different organizations, companies, and they do races on the Scioto River. And it actually happens all afternoon. There's food trucks there. It's a lot of fun.
Wow.
And then, of course, the month culminates with our Asian Festival, 24th and 25th at Franklin Park. It's fantastic. So not only do they have performances going on for the 2 days, there are dance performances, martial arts performances. We also have cultural displays, community squares. And one of the things that I've been involved with is we actually host free health screenings.
That's awesome.
Yeah, so the Asian Festival each year puts on one of the largest free health screenings in Columbus, where over the course of 2 days, we'll do anywhere from 400 to 500 free health screenings.
Oh my gosh.
Yeah, it's one of the most extensive health screenings too. So not only do we do blood pressures and BMIs and vision screenings and dental screenings, but we also do mental health screenings as well. We do cardiac risk assessments. We have pharmacy students there, and so people can come and talk about their medications, and it's all free for anyone who attends.
Wow.
That's a lot.
It's something that we're really, really proud of. You know, the mission of the Asian Festival is to promote cultural diversity and to help build a vibrant, prosperous, and healthy community, but it's also to give back. And so these free health screenings is one of the ways that we give back to the community. And to do that, it requires a lot of volunteer effort from OSU, from Ohio Health, from Mount Carmel, from individual organizations. A lot of the individual ethnic organizations contribute to this. And it's something that's actually, if you ever come and see it, it's something to behold because it's just a large, large event. The whole entire Asian Festival, but also the free health screenings as well, too.
Well, and it's an event you guys should be proud of. Just amazing stuff. I did not know the festival was that large and that you offered all of those things. So, and I fully plan on attending this year. Usually I've had a bad run of luck. I'm either sick on vacation or other things happen to me. But this year we've talked about it in my household and I think we're going to go, especially with, I have a young child. So would be there first as well. So
and this year, so every year the Asian Festival has a focus country or countries that they want to focus on. And this year, our focus countries are Vietnam, Laos, and Cambodia. And we're doing it to commemorate the 50th anniversary of the fall of Saigon, which ended the war, but also led to reunification of Vietnam, but also caused this large Vietnamese diaspora. So a lot of the Vietnamese refugees, immigrants came to the United States, and in doing so, built this vibrant, beautiful culture. Kind of contributes to the fabric of America, and we kind of want to celebrate this. We want to celebrate their culture, celebrate the resilience of the community, not only of Vietnam, but also the neighboring Laos and Cambodia. And so we'll be featuring foods from Vietnam, Laos, and Cambodia, featuring dances, performances, and other cultural displays.
Nice. And then so, Greg, I want to make sure that we repeat the dates for everyone. So the festival, sort of like the main event, is May 24th and 25th, right?
Correct.
And there are, I want to say the dragon boat races have a separate date. Is that correct?
That's right. Yeah, it's May 18th.
Okay.
On the Scioto River.
Gotcha.
Yep. And then the table tennis tournament is on May 10th at the Table Tennis Club on 8th Avenue.
Gotcha. Okay, so table tennis tournament is on May 10th. Dragon boat races on May 18th, and the main festival attractions May 24th and 25th. You've heard it here. So
that's right.
Write it down.
All of you listeners, you have no excuse. You know all the dates.
And you can go to our website. If you just type in Asian Festival Columbus, you'll see the website will have all that information. Plus, I think you will be unable to escape the marketing and the advertising campaign that we're going to have all over the city.
Good. Let them know. Let the people know.
Yeah.
I love it. So we all wanted to know, you laid out a great list of things. What is your personal favorite part of the festival? Do you have one?
Well, I'm a little biased because I've been doing the health screenings for so many years. And this year, I'm one of the co-chairs for the health screenings. And so I love the fact that we can provide such comprehensive screening to our community. Some of these people, they rely on this health screening for their annual well check, for their lipids, for their cholesterol, for their diabetes screening. And it's just so much fun to see everyone come together with that. I will tell you though is that last year I had my entire family come from Hawaii and from all over the United States, and they came to the festival and they were so impressed. Our kids were really impressed with the food. They absolutely love the food. My parents were impressed with their performances, and particularly the martial arts performances. These martial artists are absolutely amazing, absolutely amazing. And so it's just a lot of fun. It's something to behold for 2 days.
Yeah. Now, there's a question we like to ask a lot of our guests here. It's kind of like a pageant question. We frame it that way, even though it's not really a pageant. If you could wave a magic wand and change anything in the world of public health, just instantly, boom, it's done, what would you change?
Yep.
A simple question, really, right?
Well, I guess in the context of what we're talking about, the easy answer, although it's not really that easy, it's just to do away with all health disparities.
Yeah.
I guess that would be the easy answer. But, I think I'm going to take a different approach on this one. And this has to do with a lot of the misinformation that's out there, and medical denialism that's out there. I mean, we actually just heard yesterday that measles is now in Knox County. And a measles outbreak is occurring right here in Ohio. During the COVID pandemic, we had a lot of misinformation out there that not only propagated the pandemic, but actually worsened it for a lot of people. And I totally respect that people can have different opinions on things, but the denial of facts, the denial of medical evidence is something that I think is really hurting our society. And it's actually really hurting particular populations. And so I think that my answer would be, if I could have a magic wand, is maybe just to do away with medical denialism, the misinformation that's out there.
That would be wonderful, wouldn't it?
I would love that. Thank you. Thank you for waving that magic wand and doing that.
Well, with the work that you guys do in public health, I know it's such an important job that you guys do. And it's an uphill battle in a lot of ways. And so anything that we can do to help improve the lives of our communities, improve the lives of people, I think we should try to do.
Yeah.
Couldn't agree more.
So I do have one follow-up question. I do tend to save this for our more esteemed guests and everything.
It's definitely not me.
Please, Greg. So, you've brought up a lot of good topic areas, and I think you spoke really well on a lot of things, but I like to ask sometimes folks who have given such really wonderful and thoughtful answers, is there anything else that we didn't cover here or didn't ask you about that you would like the general public or our listeners to know, or if there's something that you wanted to reiterate that you said that you really want people to take home? Could be either one of those things. Any sort of like additional thoughts or closing thoughts that you'd like to let people know?
Yeah, that's a really good question. So one of the big issues that we deal with is a lack of data disaggregation for the AAPI community. A lot of people think that the Asian American Pacific Islander community is a monolithic, but in actuality, it includes dozens of ethnic subtypes. There are reports of anywhere from 19 to 62 different ethnic subtypes, all of whom speak hundreds of languages. For purposes of research, for purposes of the census, they all lump them together in one group. And we now know, again, particularly very poignant during the COVID pandemic, that that's not true, but this also can be disadvantageous to a lot of the populations. So just as an example, we were talking about the mental health part of it. So when you disaggregate the data, turns out actually it is true, but there's some disparities within that. So Korean Americans, they reported depression rates of 33%, whereas Chinese Americans only reported depression rates of 16%. Mental health, only 50% of Vietnamese American women reported their mental health as good, whereas 78% of Filipino American women reported their mental health as good. And we see this time and time again. We look at smoking rates. Smoking rates for Korean Americans are much higher than Southeast Asians, for example. And without this more granular understanding of the data, we can't really help our populations and treat our populations and understand our populations as well. And so there has to be an effort to disaggregate this data, just so from a public policy perspective, we can do better. From an individual treatment perspective, we can do better as well. The big question is, well, why does this happen? Why does this exist? And for the longest time, I think Asian Americans have been historically underrepresented in research and in epidemiologic surveys. So just for instance, since 1992, only 0.17 of the NIH budget was devoted to this topic. Only 0.1% of published articles included AAPIs in their research. And I used to do a lot of clinical trials, and we try to increase representation of minorities, of women in research studies, just so the data would be more applicable to our more general population. That's always been something really, really hard to do. And so this is something that I think is actually gaining more steam on a national level, but also on a local level. But it comes down to funding, right? And funding is always so tough, especially in an era where we are seeing a lot more funding for public health just dwindle and disappear.
Absolutely. Okay. Dr. Greg Lamb, thank you so much for being here. He is cardiologist with Ohio Health. He is the vice president of the Ohio Asian American Health Coalition and the vice president of the Asian Festival Corporation. Thank you so much for coming on our podcast today.
Oh, this was so much fun. Thank you guys so much for having me. I truly, truly enjoyed this.
Thank you. Attend the Asian Festival.
Thank you for listening to the Health is Real podcast from Franklin County Public Health. We want to hear from you. Let us know your thoughts at fcph@franklincountyohio.gov, and be sure to follow us on your favorite social media platforms. And did you know that we offer vaccine clinics and education throughout Franklin County for both children and adults? Talk to a public health nurse to ask questions or schedule your vaccine appointment by calling us at 614-525-3719 or email shots@franklincountyohio.gov.